I don't know whether you can allow me to move on and discuss the so-called chronic kidney failure. You can allow me to do?
Yeah, sure.
Thank you. Now, what now is called chronic kidney disease, in some instances, what I've already described to you as short-term kidney diseases, a small percentage can progress and go and develop what is called chronic kidney disease. That percentage is about usually 20 to 30%. I've already alluded and said 70% of short-term kidney diseases recover short-term. But there is a small percentage of 20 to 30%, which can progress and become the so-called long-term kidney disease. They are usually progressive, and they cannot reverse back. We call them chronic because they don't reverse back to that. What are some of the causes of chronic kidney disease? I'll just mention a few. There are large causes of chronic kidney disease. For example, it ranges, as I've already said, short-term can progress to chronic kidney disease or end-stage kidney disease, or there are genetic factors that predispose to kidney diseases. As I've already talked in the introduction, that combined kidneys, the so-called horseshoe kidney, is a genetic factor. Then you may have kidney problems. There is a rare syndrome from children. Children are born with a rare syndrome called Alport's syndrome. Alport's children start developing kidney diseases because they lose blood. They have a lot of blood loss in the urine, in the kidney. It's called the Alport syndrome, or what is called, the doctors call them thin membrane disease, that eventually leads to chronic kidney disease. And another one, which is very common in the public and is not known, is where the kidneys just become spongy. They become just cysts of fluid. We call it cysts of fluid formation. We call that autosomal dominant polycystic kidney disease. Those are acquired. But what the public needs to know, what we now, apart from the genetic, which you can do nothing about, there are acquired environmental factors that can actually lead to kidney diseases. Diseases like diabetes. In fact, diabetes, which is an environmental factor, is something we acquired in our environment. Diabetes currently is contributing a great deal to kidney diseases in our country. And hypertension is contributing also to long-term kidney diseases. Now, if people have got, somebody who have got a skin rash for a long time, prolonged kidney rash that could be going on, patients who have got eczema, patients who have got burns, which are not recovering, any wounds in the body that are going for a long time, they also can predispose into chronic kidney diseases. And in a nutshell, that's what I would be able to classify kidney diseases in those two categories, short-term and long-term.
Thank you so much, Dr. As we come to a conclusion, would like to know a little bit about your clinic.
Now, this clinic is called Kidney Solutions Clinic. It is located as Assumption Center, that's the Catholic Diocese of Nakuru. We are in the ground floor. We have been operational for now 1 year. Before we moved to this center, we used to work at another facility next to CK Patel. And we have been here for nearly 1 year now. And indeed, we are able to provide consultative services. As I've already alluded to, I'm a consultant physician, so I handle a lot of diseases like of hypertension, diabetes, and of course then now I'm a kidney specialist. I'm able to handle some of these illnesses, like just before this progression of illnesses go to what we call the end stage, requiring for patients to get either hemodialysis or patients going for transplant. We should be able to prevent the development of these diseases and treat them, and some of them we are able to reverse a number of patients to do well. Currently, we are able to offer the services in this of consultative services on kidney diseases, and we are able also to offer services like we are able to perform the cleaning process, the artificial cleaning process, in a process called hemodialysis in our current facility.
And there is a perception by so many people, Daktari, of private clinics and private hospitals being very expensive. How is your clinic? Is it that expensive, or is that assumption true?
No. What I want to mention to the public, health is an important factor in every individual. And the charges that we are able to charge in our facility will be commensurate to the services we are able to provide. In the this current facility, we are able to provide hemodialysis as per any other public facility like the Provincial General Hospital. We are able, currently we have been funded by the National Hospital Insurance Fund, and we are able to provide hemodialysis via the National Hospital Insurance Fund. Where we are not able to make the bridges when it comes to the consultative services, because we have to chip in for the hemodialysis. We have then to charge a consultation for our office in order for us to run the office, and in order for us to be able to provide adequate services in the current setup we are in. We are able to provide fairly good services, affordable to the public. But it depends. When the public would complain that private facilities provide expensive services, they may need to see what services are being provided, because we were able to give you, if you, in a nutshell, the best to come to an appropriate diagnosis and give you what you would think of the best treatment available at an affordable cost, but of course at a cost at which we're able to enable us to run the facility.
Patients with NHIF access can access treatment and dialysis at your clinic?
Currently, the patients are able to access hemodialysis treatment in our facility, but not yet. We have not yet reached the moment where they will be able to access for the consultative services. So I'm able to charge a fee for the consultation, but I must make it known to the public that when I have the patients who are under my facility going through hemodialysis, they benefit a lot, because I'm able to provide the particular patients going through the process of hemodialysis. I'm able to provide them a free consultative service to those who are attending hemodialysis in our facility. But certainly those others who are attending hemodialysis in other facilities, if they visit our office for whatever reason, for the specialist opinion, I'm able to charge a fee for only those coming from other facilities, but not those who are doing hemodialysis in our facility.
Ladies and gentlemen, Dr. Kiyapi from Kidney Solutions Clinic. And thank you so much, Dr. for having us.
Thank you so much too, and I hope you'll come again. Any specific, we have today gone through an overview. It's called an overview. We have not really gone to discuss specific areas. For example, diabetes alone is a whole package of what we have done today. So I hope you may come again so that we educate the public on these very important aspects of the causes of kidney diseases.
Asante sana. We're looking forward to learning more about the kidney, and any other time that we have a chance, we're going to be coming to your clinic, and we're going to expound more on the importance of us taking care of our kidneys. Thank you so much.